Difference between nephrotic syndrome and glomerulonephritis. The main characteristics of nephrotic syndrome, that is proteinuria, hypoalbuminemia, then edema, hypovolemia, and the nephrotic syndrome that occurs in age group 2 to 7, especially in males. So in case of nephrotic syndrome, it is occurs in children. Usually nephrotic syndrome occurs in children and the usual age group is 2 to 7. And the main feature when we are observing in nephrotic syndrome is proteinuria, that is in urine there will be protein. Hypoalbuminemia, when we are assessing the blood, we can see that albumin level is decreased. Then edema, usually the ana circi, the generalized edema can be seen in some time. Then edema is the facial puffiness is surely you can see in nephrotic syndrome. Then hypovolemia, that is decreased volume level. So that is the main characteristics of nephrotic syndrome. But in case of glomerulonephritis, here there will be proteinuria. Same as nephrotic syndrome, there will be proteinuria. But here the hematuria is a feature. Hematuria means in urine there will be blood. So when we are observing the glomerulonephritis urine, it will be reddish brown in nature and due to the presence of RBC. Okay, that's why the color is red. Then sometimes it will be foamy in nature. Okay, so that is the one feature of glomerulonephritis. Then hypertension, BP will be elevated in case of glomerulonephritis. And the glomerulonephritis, it occurs in school age group and also occurs in adults, especially in males. Okay, so that is the main characteristics of nephrotic syndrome and glomerulonephritis. And when we are discussing regarding the causes mainly idiopathic. Idiopathic means unknown origin. Nephrotic syndrome mainly the idiopathic causes, unknown origin, and mainly due to glomerular damage or congenital reason. Okay, that's why it is unknown. Usually it's unknown. Idiopathic, congenital, or due to glomerular damage, the nephrotic syndrome occurs. But in case of glomerulonephritis, primarily the main reason is streptococcal infection. So the glomerulonephritis that occurs mainly due to streptococcal, previous history of streptococcal infection. It may be a sore throat or impetigo. Anyway, the presence of streptococcal infection will be present. Most of the glomerulonephritis will be post-streptococcal glomerulonephritis and it may occur due to burns and also shock. Okay, but exact etiology when we are saying regarding glomerulonephritis is streptococcal infection. Next one, glomerular changes. In case of nephrotic syndrome, membrane damage causes permeability to protein or albumin. So in glomerular changes, nephrotic syndrome, there will be membrane damage. That's why there will be permeability to protein or albumin. That's why there will be edema. In case of glomerulonephritis, immune complex occludes the glomeruli. So here in glomerulonephritis, what happens? There will be an antigen-antibody reactions. There will be immune complex occurs and it will block the glomeruli. And the signs and symptoms we already seen, that is the main characteristics. And other signs and symptoms you can see is weight gain, fatigue, edema, decreased urine output. But in case of glomerulonephritis, edema, urine discoloration, lethargy. Lethargy means weakness or extreme tiredness will be present for the glomerulonephritis patient. The weight gain and edema, that is mainly due to the accumulation of fluid, because the glomerular membrane, that is more permeable to protein or albumin, escape of albumin or protein. So that's why there will be increased edema. The third space shift is more in nephrotic syndrome. The treatment, mainly the nephrotic syndrome, it is treated with corticosteroids. Glomerulonephritis, it is treated with antihypertensives and diuretics. And again, the sodium restriction, salt restriction, then potassium restriction, everything will be present with the glomerulonephritis. And the main treatment is antihypertensives and diuretics. Then prognosis, the nephrotic syndrome 80 percentage of favorable. The nephrotic syndrome prognosis is 80 percentage is favorable, but there may be chance for relapses. In case of glomerulonephritis, the prognosis is good and sometimes a recurrence may occur, but it is very rare. When we are assessing regarding the chronic glomerulonephritis, there will be recurrence of uh, glomerulonephritis, but it is rare. Okay, and when the glomerulonephritis reoccurrence is there, then it will be go to the next stage, that is kidney disorders, chronic kidney disorders. So that's regarding the difference between nephrotic syndrome and glomerulonephritis. I hope you understood regarding this condition. Thank you.